Okay, so trigger pointing, or some people call it self-myofascial release. Basically what we're looking to do is reduce and remobilise tight spots in muscle groups. So the key one for lower back health really is anything around your hips. The muscles around your hips, just from sitting down all day, tend to get very tight and stuck into certain lengths and positions. And they build up these muscle adhesions, and the muscles don't really want to be flexible and stretch properly like they should around a joint. So using trigger pointing, what we can do is you can release these balled up adhesions so that the muscle fibres will glide properly, and we can restore normal mobility to a joint. So like I say, for lower back health, it's always going to be hips. If you can manage your hips and the quality of soft tissue on your hips a lot better, which we cover in the programme, you're going to be laughing, because it will take a lot of pressure off your lower back. And you definitely notice you've been sat down all day, you do a little bit of trigger pointing at the end of the day, and your hips will feel awesome and your lower back will feel awesome as well. So definitely worth learning to do properly. It takes a little while, it takes a little bit of practice, and also for you need to learn the spots that are most beneficial for you, because they tend to be a little bit different from person to person. But yeah, well worth spending some time doing it, and I definitely recommend spending a good 5-10 minutes every single day just working on more tighter spots, and your lower back will love you for that, as long as you keep on top of it. And like I say, just take your time with it, learn to do it. It is going to be uncomfortable when you first do it. So in terms of a scale of 1 to 10, where 10's being outrageously painful and 1's being very light and you can't feel anything, at most try and get yourself to about a 7 or 8, so it's managed, and you just control the pressure in your body weight and the trigger points. And then over time, especially the more you do them, especially if you do them every day, they'll become a little bit easier each day, and they won't be as painful, and you'll find the release a lot quicker as well. But definitely for lower back health, trigger pointing, very beneficial. So take your time, learn to do it properly, and invest your time in it as well. Next trick I'm going to show you with using the foam roll is just to help release the front of your thighs. So going on from the stretches we did, the getting out of trouble video, this will help kind of long term just to keep these muscles nice and relaxed and flexible. So with your foam roll, just one leg at a time, just get lined up with your thigh, and what I'm going to do is I'm going to roll down towards my knee and slowly back up towards my hip, and just see if I get any tight spots. So you can turn your feet outwards slightly, you can turn it inwards and just hit slightly different areas. And once you find a tender spot or trigger point, what I'm going to do is what we call a pull through. So from there, I'm just going to literally pull my heel through up towards my bum, and then down and out, and do somewhere between 5 and 10 on each sort of sore spot that I find, and that should just help relax that muscle off. Make it a little bit more flexible and take some of the strain off my lower back. And then when I'm finished, I'll just change over exactly the same on the other side, get it lined up, and then I might find tight spots. Again, just pull through, just try and get that muscle to relax a little bit and just loosen up as we work away any adhesions we've got in there. So using the single body spanner ball, what I'm going to do now is I'm going to release in my glutes and piriformis area, because these muscles are tight, they're going to put a lot of pressure on your hips and make your back very stiff. So this is probably the single most beneficial thing that I can do if my back's tight, same for my clients as well. So we get the body spanner ball, make a figure 4, just going to put it underneath my glutes, and I'm just going to roll around and just see if I get some tight areas. Now for me, I tend to get it up on that top side here, so I just tilt my hips back and hitting that top edge. And usually a little bit of tightness in there, so it's more like my glute medius sort of area, very top of my glutes. And then when I find the spot that I want, I just tend to move my legs slightly and just pull through any adhesions I found, any tight spots, and just try and encourage it to relax a little bit and take some of the pressure off. And what I do then is just repeat for the other side. Okay, make your figure 4, like that. Slot in, sore spots. Again, just run up my leg slightly and just work on those little tight spots and get them to loosen up so I get some mobility back into the hips and take some of the pressure off my lower back. Okay, so releasing the TFL, because it's a little bit tricky to find, I thought it was very worthwhile me just taking the time to do an extra little bit of introduction on it. Change the colour of my shorts so you can see with the body spanner ball where I am position wise. So the first thing to do is if you stand up, if I find the front of my hip bones here where they poke out, if I come down just below both my fingers on either side, and if I just lean my body weight from side to side, you should feel a little muscle just contract each time you put the weight on one leg and then the other. And that's your TFL muscle there. So it's a key little muscle that when you sat down tends to get very, very tight, so it's worth releasing this muscle. Any downside is a little bit tricky to find, and you need to take your time to make sure you're in the right spot. So once you've found it, by doing this trick, you can feel it tensing, you're going to take the body spanner ball, and on the floor you're going to roll in here where you find it. So hopefully you can see this on camera. I'll come to the side, so I'm not on the side of my leg, I'm not way out in front, I'm in between here. I'm almost on a diagonal, I have front and side in there, and that's roughly the spot you want to be. Again, it may take you a little bit of practice to get there, so don't be afraid to adjust yourself on the floor. And you're definitely not going to be on the bone, because the bone's here, so you're below your hip bone. So it's in the soft muscular part, but it will feel very tender when you first do it. That's how you know you're in the right spot. But it does take a little bit of practice to find it, but once you do find it, it's very beneficial. If you can release this muscle, it definitely helps loosen up your hips and take some of this pressure off the lower back. So once you've got the hang of this bit here, you can find the muscle. Just line the ball up roughly in that spot. That's where you're going to hit when you go onto the floor, and it's a case of when you go on the floor, get your body weight in the right spot, roll around, and just kind of zero in and make sure you found it on the right spot. Okay, so I found my TFL, I know where it is, I've practiced finding it. So using the ball, when we get in that area, I'm just going to be turned on my side. I'm just going to roll onto it and find that little slot. So under my hip bone where that muscle is. It's usually pretty obvious when you find it because it'll be a little bit tight and painful. But this one, it's a bit hard to move on it, so I just tend to stay on it for 30 seconds or so. And just try and get it to relax. Let it ease off, and once I've done one side, do the other. I might do it a couple of times so it's really, really tight. But again, this will just help ease it up and loosen up your hips, which will take some of the pressure off your lower back and just restore some of your normal mobility. Okay, so I've released most of the muscles around my hips. So what I'm going to do now, is because if you tend to be hunched forward all day, the muscles in your upper back and the thoracic are going to be a little bit tight as well. So using the body spanner, you've got two options. You go a bit set slightly further apart here, which will hit on the edges of my shoulder blades a little bit more and digging a little bit deeper. Or when you first start, it might be better off to have them a little bit closer and just hit in the middle until you get used to it. And then all we're going to do is we're literally going to roll from the shoulder blades from the bottom just up to the top in this area here with our body weight, and just try and get all these muscles to loosen up, just to help us become nice and upright and get our shoulders pulled back again. So I get my body spanner, I've got it set up how I want it, and then we're just on the floor, get lined up. So I'm running at the bottom of my shoulder blades. I tend to open up my shoulder blades, I put my hands on my shoulders, take my head back, and then just find these sore spots I've got, and then just get to work on them. And I like to sort of move a little bit and just try and get them to loosen up. And again, this will just get the upper back to where it should be, and my shoulders sat back to where they should be, a little bit easier. That'll take some of the pressure off my lower back, and just help me maintain a nice tall posture. So we're about 2 or 3 minutes or so. Just work up and down and just try and get any tight areas you find to release. You can stay on them as well. I just prefer just to move on them Give them a little bit of work and just get them to tease up, a little bit of looseness.